Hello?
Hello, sir.
Yeah, hi, Anand.
Hi, sir.
Okay, good. Some problem in getting through. We're still not live, Alva, or are we already on?
I think we are already live.
All right, okay, fine. Perfect. Let's go ahead.
So let's start. So hello, everyone. Welcome to My Dental Plan page. This is the Dentist Speak program, the conversation with an expert. In this first edition of this web-based program, where we have prominent specialists in the field of dentistry and oral care, who will give us very important tips as to how to maintain our oral health. Kickstarting this series is a conversation with one of the most prominent maxillofacial surgeons of the country, Dr. S Girish Rao. And the topic is the one which is going on in all of our minds, the COVID times and the oral health. How is oral health management and how is oral health and impact on COVID is something that we are going to talk about. Dr. Girish Rao is a senior consultant Faciomaxillary Surgeon, former professor, head of maxillofacial surgery, consultant surgeon at NIMHANS, Shankara Cancer Foundation, founder of Implant Study Group, and founder of My Dental Plan. So let us begin this conversation, a Q&A session with him, try to understand more about COVID and oral health. I will be, for sake of convenience, dividing the questions as the pre-COVID phase, the COVID phase, and the post-COVID phase, and how it impacts oral health. Welcome to you, sir, to this particular program.
Thank you so much, Dr. Anand. Such a pleasure to come and speak today to everybody.
Yes, sir. First of all, let us begin with, we always hear that the mouth is the mirror of general health. Can we, by any chance, see some early signs and symptoms of COVID in the oral cavity itself?
Sure. I mean, we are all now in a second phase of this COVID, and most of us have had some kind of experience with this devastating pandemic, which has ravaged every part of the world. And now we are seeing such a huge kind of surge during the second wave. A lot of things have evolved, and we are understanding COVID very, very deeply. We are trying to understand, although this virus has been mutating itself. I mean, coronavirus is notorious for mutations. And the new variants which are happening is giving different kinds of symptoms than what we had seen last year. So I think a lot of oral findings are there in this new surge which we are seeing. One of the most common things which we are seeing is the fact that you are getting a lot of gingival inflammation, a lot of erythema. That means that redness or a rash kind of thing which is coming inside the mouth. And of course, you still have the classic kind of symptoms of fever, cough, and loss of smell and loss of taste. In fact, many a times people who have been tested as negative with RT-PCR test, which is like the gold standard which has been done, the moment they have basically loss of taste or smell, that is actually an indicator that there is a COVID infection. So this is something which we are understanding. And that's why today a lot of CT chest is being done as the gold standard to understand how much of basically COVID infection is affecting us. So you're seeing a lot of redness or rash in the mouth, bleeding from the gums, which of course is very, very common even otherwise also. But during COVID time, there is an exaggeration of this bleeding and a bad odor which emits from the oral cavity. Sometimes you see some pus kind of thing coming at the back of the throat. All these are common symptoms which we are seeing in this new surge of infection.
Wonderful, sir. So you mean to say in the second wave, it is no more the RT-PCR, which is the gold standard. So you're looking at many more signs and symptoms is what you're saying.
Absolutely, absolutely. Because this disease is very, very notorious, and every day we are seeing a different variant, and it is becoming much more aggressive. And that's the reason why we need to be very, very alert with the kind of signs and symptoms. Sometimes it could be a simple rash on the face, a rash inside the mouth, a redness, or an ulcer which is not healing. This itself could be an initial symptom of COVID before you even get fever or throat infection or dry cough, mouth symptoms are probably seen much, much earlier than even the classic symptoms of COVID infection.
So what do you recommend if somebody identifies these symptoms, for example, a rash in the mouth or gum bleeding or some kind of a pus discharge in the back of the throat? What do you recommend for them? Do you recommend that they go in and get tested, or what is your recommendation?
My recommendation is you absolutely need to get in touch with your doctor or dentist, because they can actually help you in further identifying this. And then, yes, you may have to get tested too.
Okay. So what are the home care remedies? See, all of us have certain exposure to this COVID virus. What are the home remedies can we do that we can reduce this viral load in the orofacial region or oropharyngeal region? Can we take some preventive measures?
Absolutely. I mean, any infection, as a matter of fact, any infection, there are two major factors which actually contribute to the development of this infection. One is how aggressive is the organisms which are attacking us. And the second thing is how strong your body's immune system is. There is a fine balance between these two. Now, something which you can definitely do is basically improving your resistance. And that is both by a physical method and as well as basically a huge psychological thing also. That itself can actually improve your basic immunity levels. So simple things like brushing twice a day. This will reduce the mouth viral load and mouth bacterial load. Because what tends to happen is in 12 hours time, there is a huge coating inside the mouth. We know for sure that there are billions and trillions of bacteria inside the mouth. There are trillions of viruses which are normally present. And this is where there is a normal fine balance. Sometimes this tip changes. So that is something which we need to do. So oral hygiene is very, very important. So brushing twice a day is very, very important. The second important thing is just doing some simple gargling. Lukewarm water, warm water, as warm as possible, not to burn your mouth, but as warm as possible. Simple rinses, doing also gargling of the throat will definitely help in prevention. Can do it a couple of times, maybe 3-4 times a day will really, really make a big difference. Using a simple mouthwash such as betadine or chlorhexidine mouthwash or just warm water with salt, these are very, very useful, along with steam inhalation. Probably twice a day steam inhalation can really, really help you in prevention of this COVID infection.
Yes, sir. With respect to the tongue, these geographic tongue or patches in the tongue, is it very common during the pre-COVID phase, or is it during the COVID phase? When do you see this?
Geographic tongue is nothing but some kind of pattern, a bald pattern in the tongue, which you can have as a very, very vague kind of appearance on the tongue. Suddenly the papilla just in some areas of the tongue just disappear. And that is the reason why you get a very vague kind of appearance on the tongue. That is typically called as like a map kind of thing, right? That's called as geographic tongue. Now, this can happen in the pre-COVID phase. It could be a very early symptom, or it could be during the COVID infection. During both the times, you can get this COVID symptoms of geographic tongue. The second thing which you can also get is you can get ulcers. These can be very small ulcers or very large ulcers involving the tongue. It could be the palate into the, inside of the cheek, the mucosa there. There also you can get these kind of pinpoint ulcers or large ulcers, which could actually say that this could be a pre-COVID infection or a COVID infection itself.
Yes, sir. So during the pre-COVID phase, somebody who has loss of taste and loss of smell, do you recommend self-medication or self-diagnosis and some other remedies, or straight away go to the doctor? What is your recommendation?
As long as you don't have any breathing issues, most of the times it's absolutely important that you isolate yourself. This is very, very important. So essentially you be in a separate room, not to infect your other family members and your friends. So please absolutely follow a quarantine thing. The second thing is today there is so much of thing happening online. So you can actually get an online consultation. Even before going and meeting any physician, there's so many platforms on which an authentic information, you need to speak to a physician or a dentist who can guide you through. So this is very, very important. please, for heaven's sake, don't become doctors yourself. I see a lot of cases. In the hospitals, we see patients coming in very advanced cases just because of the fact that they have started certain medications. Today, general population itself is becoming doctors and trying to treat themselves, and you can actually cause yourself more harm. One of the simplest things I would like to give an example is steroids. Steroid is a magic drug which, when it's administered at the right time, can save lives. But if you take it very early, for example, a simple infection which is lingering, and 99% of the times it could be just a common cold and cough. Now, if you take a steroid at that point of time, what can happen is your immunity can suppress down. And when that is suppressed, then you can get lung infections and you can get very, very severe symptoms of COVID. So for God's sake, my plea is do not basically self-medicate. Get an opinion from a physician. If you can meet a physician in a hospital or in a separate OPD where there is COVID clinics which are happening, then it's well and good. Otherwise, you can definitely speak to them online, and there is help available everywhere. We from the medical and dental community are there to support you and take you through this. But please do not self-medicate. That's my plea. The only medication which you can take, which is a simple paracetamol, that is absolutely no problems. If you have got a lot of aches and pains and you have mild fever, yes, you can take a simple paracetamol. Hydrate yourself very well. Drink plenty of water. This is very, very important. Do some warm salt water gargling. Do a betadine or a hexadine mouthwash. This will help too.
Yes, sir. The next question is slightly a technical question that I want to ask you, because the mode of transmission has been kind of perplexing to many scientists, in the sense the way this is spreading in the human body itself, from the, say, for example, the nasopharynx or from the mouth, it is spreading to the lungs so fast that they are thinking whether this is happening through the airway or it can happen through the blood. What is your take on that? Does gum inflammation or gum kind of swelling, which is already pre-existing, can it have an adverse outcome on the disease itself?
Definitely through the airway it can, because once the virus is lodged in the nasopharynx, that is behind the nose or behind the oral cavity, in the tonsillar or behind the tonsillar area, the air passage is just down there, and many a times it can trickle down and you can definitely get a lung infection. And that is how most of the times it has happened. But there are certain diseases which also spread through the bloodstream. Now, if you have a frank ulcer or there is inflammation in the gum, then we know certain diseases which affect the heart, endocarditis. This goes through the bloodstream and affects. Like that, there are some early reports saying that yes, through that also it can. But majority of the times, we're talking about 99.99%, it is all an airborne kind of thing. That means that it is going directly through the respiratory passage into the lungs. And that is where you're getting a deeper infection like a lung infection.
So do you think, like, how you maintain the immunity of the body, the general health of the body, by keeping fit, by doing exercises, by hydrating yourself, by eating on time, it is also important for us to maintain oral health, because that is where the entry of the disease is. So the gum inflammation, the kind of oral hygiene measures that the people should take in terms of maintaining good oral health, is it important? Does it have a bearing on the disease itself?
Absolutely important to maintain your good oral hygiene, not just to prevent tooth decay or gum disease, but also your general health of your body itself. We know for sure there are hundreds of diseases which actually can happen from the mouth. And if you have poor oral hygiene, that means that you have bleeding gums, that means that the gums are inflamed, or you have a tooth decay, that is where more and more of bacteria and viruses are actually lodged there, and they multiply there, and from there it starts spreading further. So it is very, very important that you keep your oral hygiene very good. And that is why we recommend you must see a dentist at least twice a year. Get your cleaning also twice a year, so that your hygiene is very, very good and your general health is going to be really, really good. Absolutely important to brush twice a day, and especially brushing at nights is more important, because you have the 10 hours or 8 or 10 hours essentially where the tongue is also resting. Tongue is a very good scrubber, and that also is resting. So there is less of pathogenic organisms in the oral cavity. Brush twice a day is my definite advice.
So now the COVID phase is done. I am aware that yes, the gum problems is something which can adversely affect the outcome of the disease. I want to go and get myself clean, in the sense I want to take some professional help. When do you advise that I go to my dentist to get my cleaning done? And how do I maintain this regimen for the next few years at least of my life?
Brilliant question. Brilliant question. Now, one of the things which we are always concerned is, can this COVID infection spread through dental practices? This is something, or can I spread infection to others? That's the concern. Or can I get this infection from a practice? Yes, if you are positive, then it's a good idea to wait for at least 2 to 3 weeks, have a negative PCR done, make sure that you're completely negative, and then you can actually go in without any major problems. Most of the dental practices do take extreme precautions, and this is something we have taken as like a war footing kind of thing. Everywhere hygiene measures are taken, sanitization of the practices, masking is absolutely important, social distances is followed, everybody is wearing PPEs and face shields, and of course you're using UV lights and laminar flows, things like that, which is actually making your experience in the dental office very, very safe. So I think it is absolutely important that you wait for a couple of weeks if you are having a symptom of COVID. And once your symptoms have completely resolved, maybe a month down the line, then you can go. But if you're not having any symptoms, it's absolutely safe for you to practice. Go in to your dental offices and get your treatment done.
So you advise a prophylactic kind of cleaning once every 6 months so that our oral hygiene remains optimum. So in case we get some kind of an infection, God forbid, we are taken care of well.
Absolutely. Absolutely. Twice a year, please get your cleaning done professionally in your dental offices. Yes. It'll really help in terms of prevention of general diseases too, not just COVID, but everything.
Very well taken. So we are hearing a lot of this terminology, mucormycosis, or the black fungus. It has hit us like a Black Friday. So can you throw some light on this?
Absolutely. Mucormycosis is a deadly fungal infection, extremely rare, but when it comes, it can really, really have a devastating effect on us. Now, there are certain funguses like mucormycosis, aspergillosis. These are normal commensals many times inside the oral cavity or in your maxillary sinus. Sinus is what we call just around, just behind on the, behind the cheeks, next to your nose. These are sinus cavities. Inside that, many times you can have these normal kind of fungal strains which are there. But when your immunity comes down, for whatever reason, you could be a poorly controlled diabetic, or you could have had chemotherapy, that's when your immunity comes down. Now, with this COVID infection, generally your immunity would have, any viral infection brings down your immunity. That is one. And on top of that, when we have had actually a lot of steroids being administered, and especially if you're already a medically compromised patient, you're a diabetic, for example, or you're immunocompromised in terms of so many other conditions, then you are very, very high risk for mucormycosis. Now, what tends to happen in mucormycosis is sometimes suddenly your teeth are all firm, they start shaking. You get very, very foul odor. You get pus discharge, multiple pus discharges coming in from around the teeth, from the gums, basically. This is a bad sign. And that indicates that you are getting a fungal infection. Now, we need to treat it aggressively. We need to take out your, the teeth which are affected. Many times we may have to take out a part of the jaw. In fact, if the infection spreads further into your eye socket or it goes into the brain, then it could be even fatal. So it's extremely rare, but now we are seeing a lot of cases because of COVID infection. And that is one reason why I would like to say, please do not self-medicate. You need to be basically monitored if you're taking steroids. Your physician will monitor you and will administer you the right dosage. So you can actually harm yourself if you self-administer.
Okay, sir. So what is your take on vaccination? Once I've got COVID, I have become negative RT-PCR, or I'm just an individual who is healthy with no comorbidities. What is your take on vaccination itself?
Vaccination is probably now the most important tool which we have, in addition to the sanitization, the basic social distancing which we are doing, and the masking which we are doing. in addition to this three, today, luckily, I'm telling you, we have had a vaccine, or we have multiple vaccines which are available today. And people ask, which is the best vaccine? I would say, don't even bother about it. At least you have some vaccine which is going to protect you. This will protect you probably about 70, 80, 90%, depending on even your immunity too. There is still a possibility, even though you've had the second vaccine, that you might still get a COVID infection. But the biggest advantage if you're vaccinated is that the symptoms can be very, very mild. You will definitely get, all of us probably at some point or the other, we will get this COVID infection, but your symptoms can be very, very mild if you're vaccinated. So my plea is, please get yourself vaccinated. And I'm glad now the government has opened the doors even for 18 plus. Because why? In children, we have not seen that much of infection. Very rarely we have seen. The initial phase of the high-risk group which was there, the elderly population, they have all been now vaccinated. The middle age has now been vaccinated. And now we are going in for the younger age group because this was the least vulnerable group. So I would request everyone to please get vaccinated, because your symptoms will be less and the chances of you dying because of this infection is going to be very, very remote.
Yes, sir. So post-COVID, post-viral syndrome kind of gum problem, how do you advise that we take our oral hygiene measures? Do we take a different brush, or how do we?
Absolutely. Yeah. One of the most important thing is, number one, please keep your brushes separately. I mean, generally what happens is, because we have one common bathroom, we tend to have everything in a brush container where all the brushes are there. And this is the easiest way of actually spreading. So the most important thing is keep it separate. And the second most important thing is keep it separate means I'm talking it in separate rooms, or carry it into your own rooms and then take it to your bathroom and get it back. This is a simple measure which can help you in basically prevention. The second thing is, if you are COVID positive or if you're a carrier, then it is absolutely important that you basically throw that old brush out and get a new brush, because this is an important way by which you can actually prevent a reinfection. So if you're tested positive, you've overcome this disease, then do not use the same disease, because the brush can also carry the virus back into your mouth, into your throat, and you can get reinfected. So it's absolutely important you change your brush frequently.
Very well, sir. So you recommend that we continue the mouthwash still, or?
I think so. I mean, you should actually do simple measures, brushing twice a day, doing simple warm salt water gargling, maybe using betadine gargle twice a day, or chlorhexidine mouthwash twice a day will definitely help in reducing the viral load. And more important, be nutritious, and psychologically, you need to be very, very strong. This is very, very important. Even if you get an infection, there's nothing which is going to really go wrong in that, as long as you're very positive and you can basically win over this infection.
That's very true, because we are seeing people taking too many measures, in the sense moment they are even having some kind of sensation loss in smell or taste, they're going ahead and booking oxygen beds and ICUs. They're using all their influence to do things beyond what is in their control. So this is something which is very, very important, to have a psychological balance and say that yes, we are all going to get it, but we will take care of it depending on the severity. Isn't
Absolutely.
it?
Please do not hoard oxygen. I mean, in our hospitals, we are struggling to give it to really people in need. And if you keep it in your garages, just thinking that, oh my God, I might get, you might be wealthy, but please spare others' lives too. And my honest opinion is, if you have any problem, there is help available there. There is online platforms too, and we are all there to help you and take you through this really rough phase. And let us all overcome this disease. Let us follow the rules which the government has set in. This is for our safety. The government can only put in rules, but the most important thing is you need to be a social, responsible citizen, not only for yourself, but for your family, for your nation, because we need every support from every individual.
So, sir, during this time, if I have a tooth problem or a severe toothache, I know we are in lockdown. We don't have many dental practices which are open. Can I reach out to, say, for example, your organization like My Dental Plan? Can we reach out to this organization for some help? Do you think that it is possible for you to help the general public?
Absolutely. We have 24/7 support every day. We are there. We are a group of doctors across the country in more than 250 cities across the nation. And we can definitely help you. We can identify the nearest practice and we can definitely handle any emergency pan India. So please reach out to us and we are here to make sure that you are comfortable and you are safe.
Yes, sir. Thank you so much for those valuable words of wisdom on oral health and COVID. So it is difficult times for all of us. Let me just summarize what Dr. Girish has put together. First of all, you follow SMS, social distancing, masking, sanitization. Preferably, if you can use a N95 mask or a double mask, it's even better. Do not self-medicate. And prevention is always better. So if you're staying indoors, if you're staying away from crowds, you're preventing. Do not try to self-medicate. The maximum self-medication that you should be taking is probably a Dolo or a paracetamol. Nothing beyond that should be taken. By any chance, if you contract the disease, do not panic. Just report, test, follow all the instructions that the doctors have to give. Maintain good oral hygiene at home whenever possible. Visit your dentist, because being dentally fit is only when your gums are healthy, because gum diseases are known to be linked to 120 general diseases, and gum health can only be maintained by professional scaling twice a year at your dentist's at your dental clinic, and also with oral hygiene measures at home. Change your brush and the tongue cleaner as soon as you're out of the infection. This is another very important take-home message. Thank you, sir, for all your inputs. We will have many such conversations in the future. Signing off now from the My Dental Plan desk. Thank you, everyone, for your time.
Thank you, Dr. Anand.